Welcome back, YouTube, to my channel for an everyday life with Aspie. If you're following me right now, basically, I'm AspieAnswersAll, and or shall we say, I'm known as Aspie right now. And at this point in time, I'm all about mental health and awareness, which is basically talking about my life journey and experience with OCD, depression, and the like, so that you guys can understand me more of a person underneath these diagnoses, as well as also trying to be a mental advocate for you all, just to support you all in the best way I can with giving you tips and advice, which is just some supporting, encouraging messages that I feel would be of use to you all, regardless of the everyday things that we go through. Not further ado, guys, basically, as I'm saying right now, I'm now starting on the next series of my learning disabilities, which is basically all about ADD, and this will go through as an ADD in the adults and the children. So bear with me, because ADD is not just for children anyway. Many people misconceive that, so I'll be covering more about the misconceptions about it later on. But in the meantime, I'm going to be talking about like the part 1, episode 2, which I marked up before. I humbly apologise, which is all about, you know, getting a diagnosis, and this one's diagnosis is in children. Now, as we all know, basically, when it comes down to, you know, getting a proper diagnosis, as I said so many times before, it's important to make an appointment to see a medical professional for a second opinion or a second form of advice, or just for diagnosis in general. Here's an example in this case of what I'm sharing with you all today, which is ADD. This is the step number 1 of the method to testing the children, getting that diagnosis in the children front. And basically, if you are worried as a parent, you know, that your child may have ADD, again, just visit a doctor or child psychiatrist or someone that's fully trained in that mental health field, basically, so that they can be able to test the condition. As they say, the earlier the better to, you know, get the diagnosis, and then you can be prepared ahead of time of what's needed to be, you know, manage and treat the actual diagnoses. Even though many people may think there is a magic fix and cure basically for all of these, but no, it's not always 100% true. It's all about maintaining and coping in the best way we can of it all. And all further ado, also basically what you've got to do also, if you're really concerned about your child with ADD, basically you can prepare for the appointment ahead of time, making the list of your child's symptoms and any difficulty he or she may have in school, preschool, or whatever, because as we know, certain ages and stages in life can take effect of certain diagnoses of these everyday mental health conditions, which is, you know, conditions in general, as I'm sharing. Take stock of the personal information regarding your child, including any recent changes that may have affected his or her behaviour. Make sure you know all your child's medications, basically, including the vitamins or herbs you've given your child. Such things can be potentially affecting your child's behaviours, maybe causing their symptoms similar to ADD. If your child has recently been tested for ADD or other mental health disorders before, though, bring any evaluation forms or evaluations you have with you. Sometimes schools may do some testing for ADD, however, and then they may further on recommend you to go to see that psychiatrist for your child. Number 2, take your child to the appointment. On the scheduled day, though, however, this next step is bring your child to his or her doctor's office. Be open with your child about what's going on, but phrase things in a non-judgmental terms, because many people tend to, you know, as I said before, go so hypocritically or judgmentally about certain things, about what's being said or what's been going on, be it a child or adult or whatever. It's all about, you know, connecting or communicating to the doctor, as well as anyone else for that matter, that needs to be put into place. It's important to obviously phrase these things in a non-judgmental term for your child. You don't want your child to feel stigmatized for having a mental health issue or condition. Instead of saying something like, we're going to the doctor to see what's wrong, try something like, we're going to the doctor to see how we can help you. You know, make them feel, the child feel like, you know, you're loving them, you care for them, and that basically in the right way of saying these terms, it won't affect the child's, you know, thinking of, you know, that there is something wrong with them mentally, physically, what have you. Many people tend to do this all the time. Okay, and the evaluations for ADD are primarily made of information for information gathering, obviously, on this term. The doctor or psychiatrist, whoever you chose to visit at that time, will ask your child a series of questions. If your child is too young to answer the questions or even to understand them, however, you may be able to step in and help on the odd occasion. Your doctor or psychiatrist may give you a series of questionnaires regarding your child's behaviour. These will have to be filled out by family members, teachers and babysitters, or anyone for that matter that has associated with your child, so that the more information that is gathered, the better, so to speak, so that they can rule out if it is ADD or some other condition. However, as we know, there's a lot of information that has been gathered to diagnose it. It's unlikely that a single report, however, will be enough. Sometimes many parents and children alike will have to go through a series of, test after test after test to come back for a follow-up and evaluation and get all the right information from us to rule out whatever else it may be besides ADD. Okay, number 3 is have your child undergo a medical exam. Symptoms, as I said before, of ADD can be caused by other underlying medical conditions or health disorders. To rule out a medical cause, your child will have to have a basic physical, obviously. Depending on the child's age and medical history, other additional exams or blood work may be required in this part of the visit of the doctor or medical expert. Your child's vision and hearing may also be developed if there's any concerns there. Number 4, answer any questions that the psychiatrist or doctor may ask. They will ask us time and time again, depending on our age and stage of our life, a variety of questions about the child's behaviour or our behaviour. They will strive to answer all the questions you can to the best of your ability. You will be asked about symptoms of other mental, health conditions such as anxiety, depression, or other conduct disorders that may come to play. These can be symptoms that are similar to ADD and may often go along with it, as I said before. You will be asked basic questions about your child's behaviour. Your doctor will then want to know when the troubling behaviour started, how severe the behaviour is, and whether it occurs all the time or just only in certain situations. The doctor will also ask about your child's eating, drinking and sleeping habits. He or she will want to know whether your child gets enough sleep, whether your child consumes caffeine, and whether your child's diet is high in sugar. You will be asked about your disciplinary methods as parents and the typical daily routine in your own home. Keep in mind though, these symptoms must be ongoing for at least 6 months to warrant an ADD diagnosis or any other diagnosis, because sometimes, as I said before, some of these diagnoses will persist later on in the different ages and stages in a child's life leading up to adulthood. Keep in mind, basically, with these symptoms, however, if they have been occurring for a short period of time only, could be the result of many other variety of factors like changes to your household or routine. Number 5, ask questions yourself. You should ask questions. ADD at this time can be confusing disorder and difficult to deal with as a patient, okay, or even as a parent. However, have some questions ready when you go to the appointment with the doctor. You will also probably need to have questions about how to proceed if your child does have this, and then again ask your doctor or medical professional basically about the various treatment options and what resources are available for parents. If you are considering medication for your child, however, be sure to ask the side effects and the best means to administrate the medication, whether it's orally, whether it's, if they need it in the form of like liquid versus tablet form, or basically they have to have it injected and whatever the case may be. You will probably have questions about how to proceed. Basically, if your child does have ADD, ask your doctor about the various treatment options and what resources are available for parents to help you along the way. If you're considering medication for your child, be sure to know about the side effects, as I said. Ask for any printed materials or website recommendations, or even just self-educate yourself or self-teach yourself about it before you go into the medical professional room. You can use these to learn a little more about ADD. Okay, number 6, see more than just one specialist. As we know, it can be challenging and costly, but it pays to be safe than sorry when it comes down to seeing one or more specialists, because obviously, when it comes down to diagnosing conditions, here's say in my case, as well as ADD, ADHD, it can be a real long process. and that we need to be sure that in order to help get the bigger picture and understanding of this, we need to see the variety of specialists to help, the child, especially to get better medical attention that they deserve. Clinical psychologists, social workers, school psychiatrists, teachers, learning specialists, and the like needs to be involved in the child's life that's in a given, as well as the education that will be consulted to make a diagnosis. Learning and language disorders can also have the symptoms that are similar to ADD again. It may also affect how it is treated. So your child's teachers and other school personnel can help with the evaluation of that point. As a parent, providing much information as you can regarding your child's behaviour, schedule and symptoms can also help this process more. Be proactive about basically your child getting the diagnosis. If your child does have ADD, the sooner a diagnosis made, the better. Check in with any doctors and specialists, however, to get these test results and assessments. Make appointments with any specialist recommended by a doctor as soon as possible. For your child's school, and speak to the principal. Be open about the fact that you like to try to determine if your child has ADD or the like. Okay. By law, though, however, in some countries, public schools are required to assist you with these matters. During these course of diagnosis, though, however, there will be a variety of tests again taking into consideration for the information gathering to rule out whatever other conditions there is. The child will collectively have a similar screening for ADD. He or she may have to also take a basic IQ test and psychological test, and that measures social adjustment. Family medical history is important to diagnose as are the interviews with the child's teachers, babysitters, and the like. As said before, you can help by staying up to date on what the information is needed. Try your best to provide this information at the request of the doctor, specialist, so forth. Well, basically that ends part 2, episode 2, basically of the testing, getting a diagnosis for basically adults, or should we say children, I should say. Give me the thumbs up for showing that you're engaging in that. Obviously, you're liking the project. Feel free to comment below if I'm missing anything in general. Feel free to also just comment below if you want to just share your life stories with ADD and every other pre-diagnostic condition that are relevant and helpful for everyone to know about it. Feel free to also subscribe to my channel on the daily, weekly, I'll be hopefully one of these videos. Feel free to also message me on Twitter or Facebook, or even on YouTube, AspieAnswersAll. Follow me on Twitter and Facebook, AspieAnswersAll. Till next time, thanks for the support so far. Do what you love what you do, and I'll see you again soon.